And this next segment is sponsored by LabCorp. Preeclampsia is a dangerous pregnancy complication that affects 1 in 25 pregnancies in the U.S. It can cause emergencies of the leading causes of maternal morbidity and mortality worldwide. Non-Hispanic Black women have a 60% higher likelihood of developing this condition. Preeclampsia is a high blood pressure disorder, but the condition can cause other serious complications, especially if not caught early. May is Preeclampsia Awareness Month, and May 22nd is World Preeclampsia Day. Now, to increase awareness of this condition, Dr. Brian Cavaney, LabCorp's Chief Medical and Scientific Officer, joins us to share valuable information on the condition, the importance of early detection, and recent advancements that will help doctors identify the issues. Thank you for joining us, Dr. Cavaney.
It's great to be with you. Thanks for having me on today.
No problem. So preeclampsia is one of the many health issues that can arise during pregnancy. Are there any certain risk factors that can lead to the condition?
Unfortunately, there are many. That's what makes it so complicated for women and their doctors to get to the bottom of it. Of course, some people have a family history of it. Some have a history of having had preeclampsia with a prior pregnancy. It's also very highly correlated with advanced age during the pregnancy, as well as weight of the pregnant person and many of the other chronic conditions such as high blood pressure, type 2 diabetes, autoimmune diseases, kidney disease, liver disease. So a lot of questions for your doctor to ask you during the early part of your pregnancy so that you can evaluate the risk and try to do the best you can to have a healthy pregnancy.
And when one is pregnant, when a woman is pregnant, there's so many different things that they are, going through. But what are the symptoms of preeclampsia and how is it treated?
This is one of the challenges and why it can be so problematic. You can't really feel your blood pressure, and you can't often tell if you're anemic or if you're spilling protein into your urine. Many women who do have some symptoms from preeclampsia think it's just part of the routine symptoms that you get from a normal pregnancy. So that's one of the reasons why your doctor often will measure your blood pressure at every visit, do some of the particular measures during the ultrasound, and increasingly ordering more of the blood tests that can identify particular proteins that help cause normal blood vessel development between your placenta and uterus, which can be a risk factor for developing preeclampsia.
And can expecting mothers be able to be tested for preeclampsia? And if so, what does that test look like and how does it occur?
Yeah, so for many years, doctors have just been trying to look at all of those different risk factors that you may have and try to make an educated guess as to the likelihood of developing preeclampsia. With research over the past several years in America, in Europe, and Israel, we now have some new blood tests to look for these particular proteins in your blood that suggest an increased risk of developing preeclampsia throughout the pregnancy. And we can combine those with some of the measures from blood pressure as well as ultrasound measurements to give your doctor a better estimate of the risk of developing preeclampsia.
Such important information there for so many mothers out there. Where can our viewers learn more information?
The best place is always to form a good relationship with your doctor. Go to all of the scheduled prenatal clinic visits, get the ultrasounds if they recommend it, get the other lab tests that they might order, take any medications that your doctor prescribe and follow the other recommendations. That's the most important way to make sure that you give yourself the best chance for a healthy pregnancy and delivery. You can get information from a ton of great websites and apps out there. One that we have is called Ovia Health. And then you can get a lot more information about all of the other tests that your doctor might order during a pregnancy at labcorp.com.
Got it. Dr. Cavaney, thank you so much for coming on. We'll see you next time.
Thanks for watching. Stick around by subscribing today and don't miss a single video.